dying. You can't move because the atrophying of your muscles has caused you to be paralyzed. A feeding tube is how your nutrients get to your body because your muscles won't allow you to swallow food any longer. If you were diagnosed with a disease that was sure to reduce you to such a state, how would you handle it? I'm going to talk to you today about physician-assisted suicide. This is a topic that I feel passionately about and have followed for many years. Today I will talk to you about the legality of physician-assisted suicide in the United States, the alternative for people who live in places where it's illegal, and some statistical information on people who have participated in it. Physician-assisted suicide isn't legal in all of the United States. The laws regarding physician-assisted suicide vary from state to state. Voters in Oregon passed an initiative for the Death with Dignity Act by a margin of 60%, allowing physician-assisted suicide. Certain criteria must be met to qualify for participation in the act. The State of Oregon Department of Human Services website states that a patient must be deemed terminally ill or having less than 6 months to live by a physician, be a resident of the state, and be at least 18 years of age to be considered. The patient must make 2 requests orally to their physician that they would like help with physician-assisted suicide. The requests have to take place at least 15 days apart. The physician has to present the patient with alternatives such as pain management or hospice care. Additionally, the patient has to submit a written request that is witnessed by at least 2 people, at least one of which cannot be related. And the patient has to be deemed mentally capable of making such a decision themselves. At any point during the process, the patient is free to change his or her mind. If the patient does decide to proceed and the physician considers him fit, the physician prescribes a lethal dose of medication that the patient self-administers. In Florida, physician-assisted suicide is illegal. The last time that the state of Florida reviewed the legality of physician-assisted suicide was back in 1997. According to an article on the New York Times website, the Florida Supreme Court elected to uphold the ban by a vote of 5-1. At the time of the vote, it had already been illegal for 129 years. The issue was brought to light when a 35-year-old bedridden man who was dying of AIDS wanted a physician-assisted suicide. In a case brought before Judge S. Joseph Davis, the patient requested to be granted the ability to have a physician-assisted suicide. The judge agreed and allowed it, stating that the ban was an unconstitutional abridgment of the patient's rights. The Florida Supreme Court later overturned the ruling, citing that the state's interest in preserving life was more important than the patient's individual rights. A study of the case by the University of Akron found the same patient had sores on his body, stomach pain, and blindness. He was stuck relying on morphine to help with all the pain. He was afraid of attempting suicide on his own, afraid that he would be even worse off if it wasn't successful. The current penalties in the state of Florida are up to 15 years in prison as a second-degree felony for assisting in a suicide per Adrian Mathena with the state of Florida Department of Juvenile Justice. So, where physician-assisted suicide is illegal, what are your options? There are always alternatives. According to the International Task Force on Euthanasia and Assisted Suicide, the law allows patients or their powers of attorney to withhold medical treatment even if doing so increases the likelihood that the patient will die. This can mean removing a patient from a ventilator. Ventilators are used to move oxygenated air into the lungs of people whose lungs cannot function on their own. One person online named Karen shares her family's experience with removing their brother from his ventilator. Her brother was left gasping for air. Death was slow, taking about 35 minutes. Another way to withhold treatment is by removing a feeding tube. Feeding tubes are described by the Family Caregiver Alliance as being used to provide nutrition and hydration to people who cannot do so on their own. Sometimes those people are in comas or suffering from something like Lou Gehrig's disease, where their muscles atrophy to the point that they can't swallow on their own. The removal of feeding tubes deprives the body of nutrition. This causes the body to slowly stop working, a process taking 1 to 2 weeks. In my opinion, these are cruel and inhumane ways to allow a person to die by depriving them of basic elements necessary to survive. Are you wondering how many people actually go through with it and what kind of people they are? Data compiled by the state of Oregon in their 2009 summary of Oregon's Death with Dignity Act provides statistical information that can answer those questions. This is a chart documenting the number of recipients who have received prescriptions for assisted suicide and the number of people who have died from using the prescription since the act went into effect in 1997. As you can see, the number of people who qualify for physician-assisted suicide and have been requesting such help has increased steadily. In 2009, there were 95 prescriptions written for the lethal medication. Of those 95, 53 of the patients elected to take the medication and died. 30 of the patients ended up dying from the illness that caused them to contemplate physician-assisted suicide. 12 of the patients were still alive at the end of the year. There were an additional 6 people who had received a prescription prior to 2009 and used it to end their suffering during the year 2009. The people who decided to end their pain with physician-assisted suicide had little diversity in their demographics. The majority were well-educated white patients between the ages of 55 and 84 who were suffering from cancer. Some of the concerns they cited were letting their conditions progress were as follows. The loss of their ability to care for themselves was cited most often. A great deal of them was also afraid of the thought of losing the ability to do all of the things they enjoyed. Why make people suffer needlessly if that isn't their wish? I hope you all have learned a great deal today about physician-assisted suicide. We talked about physician-assisted suicide in the United States, options that are available, and some information about people who have selected to participate. Even if you would prefer to live through your condition, shouldn't it be an individual's right to choose if they want to suffer? Would you want to see a loved one suffer through so much if it wasn't their wish to do so? Thank you.